Health workers at Mbarara Regional Referral Hospital are beside themselves with worry about the surge at which the spread of Mpox is increasing. With the disease partly spread through close contact, the hospital has imposed new strict measures to limit the number of caretakers allowed at the facility. The acting director of Mbarara Regional Referral Hospital, Dr. Deus Twesigye, called for a prevention of the congestion at the facility. He's calling for increased sensitization to ensure the public is aware of Ebola and Mpox.
We've now alerted all our clinicians, irrespective of year level, ranging from whoever interacts with a patient has been brought on board. But at the same time, we are going back to the radios. We are coming to your radios. We want to make sure that this information trickles down to the last person in a village.
Though the facility registered one death from a patient who had contracted the viral fever after exposing himself to the disease during travel, he's calling for the strict observance of standard operating procedures.
We are now encouraging washing hands. We are now outsourcing back all the things such that at all the entrances of the hospital and the wards, people start washing their hands.
One of those receiving treatment for the disease at Mbarara Regional Referral Hospital says he noticed that he had contracted Mpox after trying local herbal medicine, which did not provide relief. He suspects that he may have contracted Mpox from a health facility bed where he slept while seeking medication for a fever.
It starts like syphilis or gonorrhea, and then you start getting itchy rashes, and then a headache.
Mbarara Regional Referral Hospital is working with community facilities to manage Mpox. However, officials say the hospital is overwhelmed by the reach of the disease and is working through preventive measures to stem the spread.
Majority of actually around 70%, we get them from the city here, and more so in a place called Katete. Katete is dominating, but in totality, most of the patients come from the city. We've isolated very few from Kashari, I think around 2. We've got others from Isinjiro, but our main focus actually is Mbarara.
The facility is holding 88 patients in isolation facility who are responding to treatment, with many others now already discharged.